Welcome to GCC.
I've always loved children, and when I met Sebastian, we decided very soon that we wanted to have a family. It was quite challenging because we both had very stressful work jobs. So we tried for a year and a half and we didn't succeed in having children. So we decided to go to IVI to see if there was any problems with us.
IVI was conceived in 1989. I suddenly realized that the support that our specialty got in public medicine was not sufficient.
IVI, the world leaders in reproductive medicine, was founded in the city of Valencia, Spain in 1990 by Dr. Antonio Pellicer and Dr. Joseph Rimoji in collaboration with Dr. Fernando Bonilla. Since then, with the application of advanced assisted reproduction techniques, IVI has helped the birth of more than 90,000 babies. The world's foremost institutional provider of assisted reproductive medicine, IVI has 35 clinics in Europe, America and India, with the latest addition being in Abu Dhabi. Our latest technologies, coupled with the expertise of 1,350 medical specialists, including 155 physicians, have helped us deliver pregnancy success rate of 90% over 4 cycles.
GCC is the latest addition of the world-class IVI centers. Here we are bringing together the latest technology in the field of reproductive medicine, state-of-the-art equipment. We are also bringing the medical knowledge, a scientific background which has been built up over the last 25 years. Moreover, today the field of reproductive medicine is not focusing only on hormones and receptivity of the endometrium. We go one step beyond that, and we are also specialized in the genetic testing, not only of the embryo, but also on the receptivity of the uterus and endometrium. Our aim is to have a safe treatment for the patient, and we want to achieve a healthy pregnancy.
So infertility treatment is a group practice, is a group approach, where the doctors, the embryologists, the nursing staff, the support staff, the front office staff, they all come together, and the patient is right in the center of this.
In the field of reproductive medicine, a collaboration between the embryologist and the clinical part is crucial and the key to success, and that is what we have in our team.
GCC is a partnership. Dr. Fatemi, he is the former senior medical director at the University of Brussels. He's a professor there, had several years of very good experience, both in clinical experience, teaching experience, and then he moved to the Middle East.
At IVI, we pioneered many techniques and procedures which worldwide were copied and being taken over. Moreover, 9 out of 10 couples who ever visited an IVI center achieved their goal of having a baby.
It's providing the best experience for our patients, and both Dr. Fatemi and his team and what we espouse at GCC is to bring the best experience to our patients by combination of treatment, compassionate care, being understanding of what affects them, how their case is unique, and making them happy.
Dr. Juan Antonio Garcia Valesco is a director and senior consultant at IVI Madrid, and his main area of work is IVF. He has received the prestigious Research Award of the Spanish Fertility Society and the Award of the Spanish Society of Obstetrics and Gynecology. Dr. Barbara Lorenz, PhD, has over 25 years of experience in obstetrics and gynecology, including 14 years of experience in the field of IVF. Post her residency, she worked as senior consultant in the hospitals of Speyer Sindelfingen and at the Women's University Hospital of Tübingen, Germany. She has over 2 years of service in the Middle East, and today she is a specialist in fertility treatment at GCC. Sanne has completed a degree in midwifery in 2001 in Belgium. She has over 15 years of valuable work experience at the University of Brussels Hospital and has worked as a lead nurse and a counsellor at leading hospitals in Kuwait and Abu Dhabi. She has over 6 years of experience in the GCC region in the field of treating and managing IVF patients. Raj has over 25 years experience in the field of embryology. He has worked in some of the premier IVF units in the UK and has been responsible for training many embryologists and establishing fertility centres in the UK and the Middle East.
At IVI-GCC, our experience is based on years of scientific research, which helps us to deliver highly effective and responsible treatment. During the counselor will go with the couple through the treatment plan step by step, and at the end there is time to ask some questions. Also, during the treatment, the counsellor is always available for any concerns which the couple might have. Every patient is a special case.
السلام عليكم، أنا مريم. الشيء كتير حلو لما تحس بتواصل بينك وبين الطبيب. في عيادة إيفي تحس إنه الكل متعاطف ومتفهم فيك، وهذا يعطيك شعور إنه فيك تثق في العلاج وفي الناس اللي بيقدمونه.
لهذا السبب تحديداً نقوم بتحليل حالة مرضانا بعناية قبل تقديم أي تشخيص أو اتخاذ قرار بشأن مسار العلاج المقترح. ترتكز أبحاثنا على معالجة الأسباب الجذرية للعقم والمساعدة على إيجاد حل يتناسب مع الحالة الخاصة لكل مريض.
The in vitro lab really is the heart of the clinic. It's the very center, the focus of the work is made in the IVF lab. Is where you can make a difference from one clinic to another clinic.
At IVI-GCC, we provide the most comprehensive range of services under one roof. Post the initial examination and clinical counselling, basic fertility treatments include IVF, ICSI, hysteroscopy and cryopreservation. While most couples will conceive with first-level infertility treatments, there are couples who need advanced treatments. At IVI-GCC, we undertake advanced genetic testing, as well as proprietary tests like ERA. These tests are offered to couples for whom the first-level treatment has failed. Male infertility is an equal contributor to the problem in many cases. Advanced andrology services help men overcome fertility issues and comprise of treatments like detailed semen analysis, testicular sperm aspiration and microtesticular sperm extraction for superior results.
Since we know that according to evidence-based medicine, a singleton pregnancy is a healthy pregnancy. We should avoid multiple pregnancies, since multiple pregnancies might later be linked to future complications.
IVI-GCC is your best chance of having a baby. We use the latest medical advances in the field of infertility treatment, both the latest generation equipment and the most recent scientific advances. For the IVF laboratory, the IVI-GCC has designed a clean room to provide the highest quality and best environment for healthy embryos to develop. We have 4 ICSI state-of-the-art incubators, 4D ultrasounds, an embryoscope, the first Ziltrix monitoring system in the GCC, and an RI witness system.
IVI-GCC has his own blood lab. We can do a lot of in-house tests and we can provide our patients on the same date with the results. This is really convenient for them because we can speed up the treatments.
The focus of research was on the Western countries, in Europe, in the States, in Australia. We completely failed to understand that there might be a different reason, different cause of infertility, which might be regional specific. For example, consanguinity. It means marriage in the family. We know that 60% of the local population in UAE is married to the first or second degree cousins. We were among the first who ever published that the first generation of consanguine couples has a higher probability of having a reduced ovarian reserve, which is again linked to infertility. We also know, due to the publications, that almost 100% of the local population has a vitamin D deficiency. And we have also detected that this vitamin D deficiency is related to a reduced ovarian reserve, and apparently it has also impact on the reduction of the sperm production. The population in the GCC countries has a high prevalence of obesity. And also we know that obesity has an impact on the receptivity of the endometrium of the uterus, and it has also a negative impact on the quality of the eggs and of the embryos. So we see that this population has a specific kind of infertility, which cannot be compared with the infertility that we are seeing in the Western countries. Once you know the cause, you can prevent these kinds of infertility in future, and that is only possible through research.
Over 90,000 healthy babies are born at EV clinics worldwide, which is why EV is the preferred choice of patients and referring doctors in the geographies it operates in.
عندما يتعلق الأمر بالتلقيح الصناعي قد تخطر إلينا العديد من الأسئلة التي يصعب علينا الاستفسار عنها. إن الأطباء والمستشارون في مركز إيفي قد جاوبوا عن جميع الأسئلة والاستفسارات المتعلقة بالعلاج ونتائجه. شفافيتهم واهتمامهم بالمريض جعلتنا نشعر بالراحة والطمأنينة.
Genetic screening and diagnosis of a couple before pregnancy helps promote the birth of a healthy child. Advanced tests include compatibility genetic testing, pre-implantation genetic screening, which is PGS, and pre-implantation genetic diagnosis, which is PGD, for single gene disorders. Tests like the products of conception POC using array are reliable in ascertaining the cause of frequent miscarriages.
At EVGCC, we concentrate on each one of our patients. We personalize their treatments. And what this results in, a much higher success rate, of patients becoming pregnant, becoming happy parents, happy couples. And this is translated in, EV being recognized as one of the leading institutions for treating infertility around the world. And we've been bestowed with numerous awards and accolades from various medical fraternities, institutions, as the leading provider of IVF treatment.
At EVGCC, our biggest award is the happiness we see on people's faces whenever we tell them that they are expecting a baby.
Right from day one, we are there every step of the way.
لنساعدهم على تحقيق حلمهم بالحصول على الطفل.
This personalized attention is what makes us unique. We are your best chance of realizing your dreams.
High quality, affordable,
and ethical treatment. We are EVGCC.